Hey, Steve Glover is with us. He's got 40 years of business experience in biopharmaceuticals. He, of course, is the chairman and CEO of ZyVersa Therapeutics. They are publicly traded on the stock symbol ZVSA, and of course, he is also in the state of Florida. And we're happy to say that Steve is alive, well, and hopefully mostly dry over there. But what has that been like this year? I know you're on the other coast, but still, that's got to affect everything that's going on over there.
Well, it's like a game of whack-a-mole. You kind of dodging the hurricanes and the wind, and you end up with tornadoes. Let's just say it's an exciting time to live in Florida.
Yeah, that's one way to put it, buddy. It's an exciting time. Hey, let me ask you. You had a really great press release that came out earlier in the week that we talked about. I want you to say it for the folks that didn't hear it. Walk us through exactly what's gone on because there's so much around this, and the good side is that you guys are at the right place at the right time once again.
So it's good to see everyone. It's been since the summer. There's a lot going on in this whole obesity inflammation market, and we were fortunate enough to work with a really renowned group of people over the summer trying to figure out how to move forward into this area. And we were proud to announce that they not only agreed to work with us over the summer, but joined our scientific advisory board. These are a host of people from the likes of Harvard and WashU and actually UC San Diego with Dr. Olevsky, just people that have been studying this issue for most of their careers. They're practicing physicians as well as researchers, and their feedback has been immeasurable to us to move forward into our next stage of our development of our product, IC100.
I think what's interesting here is when you talk about the market that you're in, how much has it exploded literally in the last, and I think we know why. Talk about that a little bit.
Just yesterday, actually, Medicare came out with a projection that Medicare expenditures for obesity-related products alone will be $35 billion in 2 years. Yeah. That's an amazing number when you think about it. 50% of the worldwide population is obese and has inflammatory conditions. And the market trend here has been really interesting. Everyone knows that you can see an advertisement for Wegovy, which is an incretin, and you can get access to that, but right now you're paying mostly cash for that. But the trend here is towards combination therapies. And these combination therapies are not only treating the obesity, where you're getting, a loss of fat, 50, 60% fat loss, but the trend now is to add a product that prohibits excessive muscle loss. That's one of the issues within the treatment paradigm right now. And that combination trend has led to several IPOs over the last 90 days and has led to the next step, which is combination therapy with an inflammasome inhibitor added to that regimen. In fact, Sanofi and Ventex just announced last week a $27 million investment from Sanofi to do phase 2 to add their inflammasome inhibitor to those regimens. So just a really explosion here in a $100 billion plus global market.
Steve Glover is the chairman CEO of ZyVersa Therapeutics, their ticker symbol, ZVSA. Steve, with that unprecedented level of weight loss and the achieved with the therapy and things like that, developments with the drugs, do you anticipate that the investment in the category will go down?
It's actually, I thought so initially because of investors' interest might soften a little bit. It's actually been the opposite. We just saw a report that there's been a 10-fold increase in venture capital into the area. IPOs are beginning to take place, and investment dollars are flowing very rapidly here. And the reason is that next step I talked about around combination therapies to go after these comorbidities. So as someone who's obese, they're actually not only obviously suffering from the weight problems, but you're seeing cardiovascular disease,
Yeah.
type 2 diabetes, these comorbidities of which we're looking to treat, explode in their funding areas. So people are looking to fund into these areas to look at those comorbidities. They think inflammasome inhibitors like ours are a real key to that. And so it's just a really explosive area right now.
That's like the BioAge deal, right? I mean, they got $170 million for that. I forget the name of the drug, but I mean, it's to your point. Their lead candidate is intended to be used in combination with those. I think it's called incretins to prevent weight gain. I mean, that proves your point.
That's exactly the point. And you've seen this in the acquisition. So, for example, that product is a muscle sparing product to be added to a product like Wegovy
To keep you from losing muscle, right?
And that really is the first step. The next step is adding in these inflammasome inhibitors. And you're seeing spaces like the CB1 space, right? You're seeing companies looking at different approaches where they're using combinations as well. You're seeing billion-dollar deals like Novo and Lilly acquiring companies to provide these combinations. It's just, it's a lot like the immuno-oncology space was 15 years ago. As you move towards combination therapies, you get better patient outcomes.
Exactly.
So I just wanted to ask a quick clarification that with these people that may be using Wegovy or whatever these weight loss drugs are, they may be getting skinnier, but there's still the chance that there's inflammation because they're related, but you could still be, skinnier people can still suffer from inflammation.
Yeah, you can be skinny fat because you don't have muscle,
Right.
and now you're less fat, but now you're subject
still
to
have
the
issues.
inflammation.
Yeah, right.
Well, it's a great question because really, if you think about it, when someone is obese, they have cardiovascular problems, they have hypertension, they have maybe type 2 diabetes. Actually, you're seeing things around Parkinson's increasing in obesity. And just because you're losing the weight, you have not modified your underlying disease that I just talked about. And those diseases are driven by inflammation, and that inflammation doesn't go away even though you're getting thinner. As a matter of fact, the fat tissue, what's called adipose tissue, as you lose weight, actually releases inflammasomes. It releases and modifies the inflammation to even become more pervasive. And as a result of that, you need to treat this inflammation as well.
Well, and Steve, the moral of that story for plain speaking non-medical folk is that ZyVersa's inflammasome inhibitor fits perfectly into this whole space.
Yeah. That's exactly the point. I mean, you're looking at this and you say, well, I want to make this patient healthy. I need to treat the inflammation. And that's where our product IC100, which is a monoclonal antibody or biologic, really fits into the treatment regimen. So we're very excited by the progress here.
Steve Glover, Chairman, CEO, ZyVersa Therapeutics, ticker symbol ZVSA. He's going to help me with my BMI. It came back canned ham the last time. I went and saw the doctor. Steve, always great to visit with you.